Good morning, everybody. I'm Desiree Mills. I'm a nurse practitioner at Rosenall Medical Center. Is this okay? Can you guys hear me? Yeah? Okay. The slides on your app is going to have a different title for the presentation today. It says folate receptor autoantibodies and neurological disease, but yes, we will be talking about leucovorin for autism today. We're also going to be touching on cerebral folate deficiency, testing, and treatment. Some disclosures. Nicole nor I do not have any significant financial conflict of interest in the treatments and services that are discussed in this presentation. We are not giving medical advice. We do try to present the information as accurately as possible. Okay, and some important concepts to discuss before we begin. We know that autism spectrum disorders has a biological basis with features of known medical disorders. It is not just a mental health issue. It is not a psychiatric disorder. Some of the known medical disorders associated with autism, constipation, yeah. And there are also metabolic abnormalities that are also reported to contribute to autism stereotypies. Such metabolic abnormalities would include cerebral folate deficiency, mitochondrial dysfunction. So the goal is to screen for these abnormalities, these metabolic abnormalities and medical disorders, identify them and start treating them with actually very common testing: blood, stool, urine, buccal samples. Here is a list of some medical disorders that are associated with autism spectrum disorders. Here you'll see the cerebral folate deficiency, which we will speak a lot on. Other metabolic disorders are creatine deficiency, disorders of purine metabolism, and so forth. Okay, so what is cerebral folate deficiency? By definition, it is any neurological or psychiatric condition associated with a low 5-methyltetrahydrofolate level in the spinal fluid, or 5-MTHF, or to also be interchangeable with folate, so low folate in the spinal fluid, okay? The most common etiology of cerebral folate deficiency is autoimmunity. We first saw this disorder about 30 years ago and saw this in autism about 20 years ago, so not too long ago. And there have been studies that report that males are 3 times more likely to have this than females. Here are some potential symptoms of cerebral folate deficiency, or CFD. Irritability, anxiety, poor sleep, developmental delay, or slowing of typical development, seizures, problems with vision, tics, and so forth. It's important for us to talk about how folate actually gets into the brain, because this will lay a foundation for how the mechanism leads to low folate in the brain, and also for treatment. So what happens is 5-MTHFF or folate will get transported through the, I'm going to skip ahead, through the blood-brain. Here's the blood-brain barrier. Here's the blood. Here's the brain. And what happens is folate, let's see if my animations work. Yes. Okay. So this folate being received by the receptor and getting transported to the brain with the help of ATP which is a form of energy made by mitochondria. Okay, so this process is ATP dependent, which means that we do need healthy mitochondria to help get folate into the brain. Oh, that's annoying. Okay. So it's also important to differentiate folic acid, folinic acid, folate, 5-MTHF. So there are inactive molecules in our body and active molecules in our body. And in order for an inactive molecule to become an active molecule, it has to go through a process called methylation. If it doesn't, then essentially the molecules are useless for our body. Folic acid is the inactive form of folate. Folinic acid is the active form of folate, which is the main ingredient of leucovorin. Okay. So what can cause cerebral folate deficiency? We mentioned the mitochondria. So if our mitochondria is not making enough energy, then folate's going to have a hard time getting into the brain, right? The other potential cause is folate receptor autoantibodies. So these autoantibodies were first reported about 20 years ago. They are associated with CFD, low-functioning autism, Rett syndrome. And what happens is when we have autoantibodies to folate, it will block the receptors so that folate cannot get into the brain. There are two types of these autoantibodies, blocking and binding. So here we have, again, an illustration of the blood-brain barrier, blood-brain receptors. Just a reminder how folate gets into the brain. Okay, and here are the two types of autoantibodies. We have the blocking and the binding. So blocking, it will literally just attach, it will block the receptor, and the binding will attach itself to the receptor, kind of morphing it into a shape so that folate cannot recognize it and therefore does not get into the brain. So you can see folate not getting to a brain, so now we have low folate in the brain. All right, so where do these autoantibodies come from? Why is our body making it? It comes from cow's milk. So the reason why our body is making autoantibodies to folate receptor is because human milk and cow's milk are almost structurally identical, and so are its antigens. So sometimes when we are exposed to milk, cow's milk or casein, our body doesn't like it. It produces autoantibodies that attach or block the receptors. So this is an interesting study that was done. It shows that, this is a graph that shows the concentration of the blocking autoantibodies in the blood, and this is the initial sample. This is the concentration of several patients. And then they went on a milk-free diet, and look what happened. The concentration of the autoantibodies decreased significantly, some virtually to nothing. Now, we re-exposed the patient to milk, reintroduced milk back into the diet, and then look what happened. The concentrations increased again, sometimes exponentially. What's nice is that we can test for folate autoantibodies and folate receptor autoimmunity. We can test folate in the blood, homocysteine in the blood, B12. We can look at mitochondrial biomarkers. We can test for the MTHFR gene mutation, which tells us if the body's having difficulty methylating, which is that process that converts inactive molecules to active molecules that our body can actually use. You can also do a spinal tap, but that's no fun. It's very painful, very invasive, probably the most accurate, but I would recommend other ways and other methodologies to test for low folate in the brain. Another really good test is the folate receptor antibody test, which is called the FRAT test. And this will test for the presence of both types of autoantibodies, blocking and binding. Okay. So I mentioned earlier that when you remove casein or cow's milk from the diet, that will help with the cerebral folate deficiency or low folate in the brain. Another part of treatment for low folate in the brain is leucovorin, which is basically high-dose folinic acid. So here we are, you have your antibodies, they're just floating around, and then the idea is with leucovorin, we flood the body with as much folinic acid as possible so that it will find any which way, any open receptor to get transported into the brain. And that is my portion, and Nicole has some interesting slides for you.
Perfect. Thank you, Desiree. Desiree is a fantastic nurse practitioner, so she's great to work with. So I'm Nicole Rincon. I'm a physician assistant. I've been with Rossignol Medical Center for 9 years. I've been a PA for 18 years. I've helped author studies at Rossignol Medical Center. Dr. Fry, Dr. Rossignol, and I published a trial, a paper with last year looking at biomarkers for mitochondrial dysfunction and a meta-analysis. So very, very interesting paper if you want to talk to me about that after as well. But today I'm going to be talking about studies associated with CFD, which is that cerebral folate deficiency. It's important. I know that we kind of know the basics, and that's absolutely important. And I'm hearing a lot of patients, and also just the public, coming to me and saying, I'm asking my pediatrician for leucovorin prescriptions, and they're saying, they're telling me there's no studies, there's no literature, it's not been tried, it's not been looked at. So I think it's important to address studies today, and I'm going to try and show you and hopefully, like I said, illustrate that there are a lot of studies, and there's a really, really good body of evidence that it's very effective for autism. I do apologize, the slides are a little thick and information heavy, so I'm going to try and just break them down, talk about the main take-home talking points. But again, you guys can look at them later on your own time. The slides have a lot of information, so and of course, feel free to contact me if you have any questions. And also, last thing, this is my kids. This was last month in September. We went to Sequoia National Forest. These are my twin boys and our cousins, so represents part of the loves of my life. I got National Forest and kids. So for the first slide I want to talk about, and this is a very important trial. Again, this is going to be about maybe 10 studies or so, just to forewarn you. But this first one is actually conducted by Dr. Fry, 2013, so it's about 12 years old now. It looked at 93 kids with autism. It found that 75% of them were positive for at least one type of folate receptor antibody. In the study, they gave a dose of 2 milligram per kilogram per day, divided what's called BID, so divided in 2 doses, so a morning and usually afternoon dose, with a maximum of 50 milligrams, so 25 milligrams and 25 milligrams at a maximum, and they treated them for approximately 4 months. Now this dose, just to kind of front load you, this is a dose that we frequently use in clinic. There can be higher doses, but this is typically the mainstay that we want to look at when we're going to the target dose of treating kids with autism with folinic acid. So again, this trial looked at a 4-month-long study, and it found significant improvements in communication, language, attention, and repetitive behaviors. So this is a really big deal. These are addressing many core issues with autism, not just addressing one specific symptom. If you put a child on risperidone, that's going to maybe look at irritability, but these are hitting core issues. So very, very, very important study. And a third of these kids actually had moderate to much improvement. So this is not just, oh, they had maybe, a couple sounds or some mild improvement. This was significant language improvements. And in this trial, there were minimal side effects. So this slide just illustrates here that this bottom column here, it's basically 25% of the kids were negative that they tested for antibodies, but 50% were actually positive for one, either binding or blocking antibody, and then about 25%, a little over, were actually positive for both. So very prevalent in the population here. And I threw this slide in here because it is important to note that in this particular study, Dr. Frein found a correlation between thyroid stimulating hormone and blocking antibody. So what does that mean? It just means that as maybe the thyroid is slowing, these folates, there is an association with higher folate blocking antibodies. So in clinical practice, it's important to look at both. When we assess kids with autism, we're almost always going to get a folate receptor antibody test, but also test thyroid as well, because there can be an association. So good to note there. The second study here I looked as actually from 2007. This is a pretty important trial. It looked at 25 patients with low functioning autism, and they actually did spinal taps on these kids to assess if they actually had cerebral folate deficiency. And they found that in these 25 kids, 23 of them were low. So most of them, right? And out of the 23, actually 19, which is 83% of them, had these folate receptor antibodies. So they kind of postulated that's the main cause of this. As Desiree mentioned, it is autoimmune in nature. And this particular trial treated with folinic acid for 12 months, not just the 4 months, so a longer study, and they used 1 to 3 milligrams per kilogram per day, so a little higher dose, and they found really good results. The two youngest patients in the trial, ages 2 and 3, actually were cured and fully recovered from their autism and their neurologic deficits. So very potent. 3 of the the oldest children in the study didn't recover from their autism, but they did show improvement in their neurologic deficits, like movement and coordination. And then the remaining 13, that middle cohort, that middle group of kids, had improvement in social interaction, improvement in communication, and improvement in perseverative behavior and restricted interests. So many of the core issues, all the kids saw some improvement in certain areas. And this is a kind of a complicated graph, but it does illustrate, this is from the study and the results of the study. So if you look here, this shaded area here, it represents the kids ages 2 and 3 that had complete recovery, so they weren't included on the graph here. But then the other kids, as the age went up, some of the improvements in autism unfortunately went down, but if you look at any age, they all saw significant improvements in those pyramidal deficits, ataxia, so again, that movement and coordination. And 70% still saw improvement in irritability, even at age 12, which is huge. And even at any age, the children saw improvement, in some improvement in their autism symptoms. So there was no age in which we found no improvement, which is really big. This is actually a child that was in the trial, and they took her out and made her an individual case study. She's an 8.5-year-old girl, and unfortunately, she was diagnosed with cancer during this trial. They actually gave her they gave her methotrexate as a chemotherapy agent, which actually blocks the conversion into active folate, so it blocks folate in your body. And they tracked her for 6 weeks after they gave her methotrexate. And what they found is that over that 6-week period, you can see that her folate receptor antibodies, it's that rectangular line there with the rectangular little dots. As the antibodies increased, the aggression increased as well. So they found a big correlation with these antibodies and actually her aggression. And then also, They found that unfortunately her seizures went up during this time as well, and her communication decreased. So they found that as they were tracking these antibodies, her overall functioning went down. And so it's really important, it's an important case study to look at that they may be directly correlated, and most importantly, treatable, right? If it's a problem of active folate and these antibodies creating a problem. So that was a great study. We have another one, actually. This is by Dr. Fry. This was 2024, so it just published last year. And he looked at 110 kids with autism, average age of 10 and a half years, so a little older than some of the other studies. And he found that basically the higher binding titers, so if those antibodies are higher, it was associated with a greater irritability. So this is a study basically kind of confirming that previous case study, so that with the antibodies going up, so does irritability, so does some of the symptoms and the aberrant symptoms we see in autism. The study found that leucovorin helped improve irritability when they treated with it, and it also improved social scores when they tested them. So the most important thing as well with this is that the higher the binding folate receptor antibody titer, so again, those higher those levels of antibodies, was associated with a greater response for social improvement. So what does that mean? It's actually kind of a big deal in our practice. It really means that we think that, these higher antibodies may be a good clinical indicator of who's going to benefit from leucovorin. This is, of course, not a be-all, end-all, but it helps guide our treatment. So maybe if we have children with really high antibodies, maybe we treat them at a higher dose or for longer, or if they're having an issue, they're not tolerating it well for some reason, maybe we need to think outside the box. Maybe we try it compounded, try supplements, calming things first. But essentially, these kids may really desperately need folate in their brain, so it helps, like I said, guide our clinical judgment and who may benefit. And so this is a graph just illustrating that as you go from left to right here on the graph, that the antibodies are going up, and as the antibodies are going up, the scores are decreasing, which is a positive thing. It means that social is improving, especially in the category of social awareness. So these kids seem to just have better cognitive and situational social awareness. So very, very important. And again, that was just a brand new study. So it's really exciting. This literature is just coming out. That was from last year. I included this study. It's from 2020. And it's really interesting because we'd been previously talking about higher dose folinic acid, right? That 2 milligram per kilogram per day. And this study said, well, what if we do lower dose? So they looked at 5 milligrams twice daily. So that's a fifth, a fraction of the previous dosing. And they did find that even at this dose, in 19 children, the global autism scores, social interaction, and communication were also improved at the 12-week mark. So, and in this study, no side effects were noted. So it's important. This is a good, again, teaching point for our clinics and for just people in general, that if your kids are having a harder time tolerating the high dose for some reason, there may still be benefit, even if we get in 5 milligrams twice a day, and that's where they end up being tolerated, the dose they tolerate, that there is clinical improvement still to be had, and this has been demonstrated here. So it can be beneficial at various doses, essentially. And this is another trial we looked at, looking at, basically they added on folinic acid to risperidone treatment. They added as what's called an adjuvant. So they add it on, and then they see what improvements are made, either with risperidone or with risperidone and folinic acid. And again, these kids were a little older as well, 13.4 years on average, and they gave them that same dosing we'd been looking at, 2 milligrams per kilogram. And they found that when adding on folinic acid, it improved not only speech, not only repetitive behaviors, but also hyperactivity and noncompliance. So very, very important to see that essentially there's other areas that leucovorin can treat. So we know speech, we've heard about attention, we've heard about the repetitive behaviors, but even in hyperactivity and noncompliance. I have some parents say, well, my kid's too hyper, they won't be able to tolerate folinic acid, and so I don't want to start it. And that may be true, and that's why you should work ideally with somebody who has experience, but it also has been shown to help hyperactivity. So I know in my personal experience, which I'll share in depth a little later, my son, when we started him on folinic acid at, I think, age 4, he had better cognition almost immediately. Speech improved slightly, but the main thing that I saw with him was a decrease in his hyperactivity, and he just calmed way down. And he was much more compliant. In preschool, he was following orders where he wasn't before. So in certain kids, and certainly I think in my one son's case, it definitely improved this area. So good to note here. And on the note of other areas of what can be treated by folinic acid, what symptoms might improve, this is a really big study, very, very big study. 2024, last year it was just published, and it looked at 47 kids with PANS-PANDAS. So for those that you don't know, this is pediatric acute onset of neuropsychiatric syndrome. It's a big, long word. It just means acute onset of kind of OCD, tics, usually restricted eating, severe anxiety, so severe behavioral changes almost overnight. And in these kind of kids, they found that actually 63% of them were positive for either blocking or binding antibodies. And ironically, the kids that were comorbid with autism, so they had this PANS-PANDAS or autism, actually had lower binding titers. So autism seemed to have lower antibody levels. And the ones that had severe tics associated with this had higher binding titers. So this really is really groundbreaking because it may indicate the treatment of PANS-PANDAS in the future. This may be, certainly I would argue that it's something that we should all be looking at as clinicians, as parents. Hey, my kid's got PANS-PANDAS, maybe they have cerebral folate deficiency. And this case looked at, the paper looked at actually a case of an 18-year-old, and what they did is they, I think they started to follow him at 13. He had PANS. He was being treated with IVIG and antibiotics. He initially did well, and then he became treatment resistant. So what they did is they tested him for a bunch of things. He was not making improvement. Eventually, they tested him for folate receptor antibodies. He was positive. And they treated him with Leucovorin 30 milligrams daily. And after, I think, a few months, his overall improvement was 90%. So this child, they reported that his anxiety was essentially gone. He was able to go to college at 18. He was able to live on his own, where he was severely disabled. So this is really, like I said, not just for autism. This could be really important for the treatment of other neuropsychiatric conditions, like PANS-PANDAS. And then the last study I want to talk about specifically with kids, with autism and cerebral folate deficiency, is the meta-analysis done by Dr. Rosignol and Fry. This was 4 years ago. This particular paper looked at 21 studies. So there was a lot of evidence. Again, when clinicians say there's no evidence, there's definitely a lot. There's 21 studies here that they looked at. And even since this was published, there's been, as you've seen, several more. But they found that the prevalence of cerebral folate deficiency in autism was 38%. And this was confirmed, again, by that spinal tap. Not necessarily just suspected. And they found that the etiology of the cerebral folate deficiency, so the cause of it, was attributed to these antibodies in 83%, so the majority of causes. And they also found that mitochondrial dysfunction was associated with it in 43%. So it's an important point, and Desiree talked about it, is that it does take energy to push folate into the brain, and so mitochondrial dysfunction can be a cause of cerebral folate deficiency. And so what we do is, even if the kids, obviously if we test for folate antibodies and they're positive, it's prudent to treat them based on this evidence. But even if they're negative, there is a case, like what happened to these 17% of kids that test negative. They could still have cerebral folate deficiency. So we may want to treat the mitochondrial dysfunction, especially if we're seeing those markers. And, things that might treat that, that's a whole nother talk, of course, but CoQ10, ubiquinol, that is CoQ10, carnitine, B vitamins, antioxidants, NAC, Even B12 and folate can help with that mitochondrial dysfunction. So that, in conjunction with leucovorin, can actually really help optimize the treatment. So it's important, I tell patients, leucovorin is great and it's helpful, but it may not be, the be-all, end-all. We may need some mito support in there too, in addition to looking at all other aspects of autism treatment. But big point. And then overall, the study found that the prevalence of folate receptor antibodies in autism was 71%. So again, this is a really prevalent issue. And children with autism were actually 19 times more likely to be positive for these antibodies than typically developing children. So super, super common in autism, and probably a core issue with their development. To further in the same study, for individuals with autism and cerebral folate deficiency, that was confirmed, they found that they had 67% of kids had improvement in overall autism symptoms when treated with leucovorin. So that's two-thirds. Two-thirds had improvement. That's a lot, especially for a meta-analysis. Very significant. Irritability improved, ataxia improved, pyramidal symptoms, movement disorders, and epilepsy actually improved in 75%. So this is a big take-home point, is that a lot of these kids have epilepsy comorbid, along with their autism. So it's really important to look at the cause of epilepsy. Maybe it's due to cerebral folate deficiency, and treating with something as simple as high-dose folinic acid might be able to stop or certainly improve their epilepsy symptoms. And I do see this a lot too in our kids that hit puberty. It seems that puberty can sometimes trigger epilepsy in kids, and when these kids get older, actually studies show that folinic acid tends to decrease in the brain, and this may be a stressor for kids with autism. So essentially, if they're having new onset seizures, look for cerebral folate deficiency as well. And the take-homes for this big study is that essentially what they call the effect size. So kind of what's the body of evidence? It showed that there was an improvement of communication to a medium to large effect size. So that means there was a medium to large improvement in communication overall in these 21 studies. And they also found that there was attention and repetitive behaviors actually improved to a large effect size. So again, a large change in repetitive behaviors and attention. So lots of evidence here, guys. So I usually, when I ask parents, I give them this study. I say, hey, bring this to your pediatrician, bring this to your neurologist. They can look at the meta-analysis. This is not just a one-off trial with a handful of kids. So very important. The most common side effects found would be aggression, excitement, agitation, headaches, insomnia, and increased tantrums. And I'm here to tell you, I do see this sometimes in clinical practice. This is not nothing. Some kids do tend to get really activated, and that's kind of the word that most people use. We do have strategies to mitigate this. In our practice, we typically try to start with something calming, calming supplements. Maybe we use magnesium or that broccoli extract like sulforaphane, omega-3, theanine, GABA, taurine. There's a lot of calming things you can do first that may help them tolerate this better from that hyperactivity that they sometimes get. And also, it's important to note, and you guys are all experts here. You could probably have you teach the class, but a lot of it is starting low and increasing slowly. So starting at a few milligrams and increasing maybe weekly. Of course, talk to your provider, but that slow increase, what's called the titration, can sometimes really help reduce those symptoms, and so that the child tolerates it. And then the last side is that if we get to a point, let's say we get up to 25 milligrams twice a day, and the child's just not tolerating it, we may just back down the dose to a previously tolerated dosing, maybe 10, 15, and leave them there for a while. And again, I feel comfortable with this. Maybe at the next visit after 8 weeks or so, we try increasing it. And a lot of times that actually helps just to get the brain acclimated. So, a lot of strategies we can use. And so that was about the kids. So I do want to spend this is my one study about the families. So it's really important. We talked about the importance of, kind of it being prevalent. And this is, it's I think, a lot more prevalent than any of us realize. They did a study, this was from 2018, and it looked at 82 kids and their families with autism. And they confirmed, similar results that we'd been seeing. About 76% of the kids had these folate receptor antibodies. But they also found that 75% of the unaffected siblings had it. So it looks like the siblings of kids with autism also are positive for these antibodies. So very important to note. And also this 69% of fathers and 59% of mothers. So, this is not just an isolated autism issue. This isn't, usually these travel in families, even in grandparents. So the take-home point for me of this is that, I just had a parent that just came to me right now outside and said, well, my son is being treated for his autism, but the sibling has, ADHD, or the sibling has OCD, pandas, and what can be done. And there's this idea that it's only the child with autism that's being affected. And the siblings may have it as well, even if they don't have autism. Maybe they just have insomnia, or not just, but maybe they have insomnia, anxiety, other issues, like I mentioned, ADHD. So it's important to look at siblings and treat them appropriately too. I think, again, this is a really widespread issue, and it does tend to run in families, according to this study. In practice too, we're parents, we're autism parents. I'm going to share my story in a minute, but as autism parents, we can't pour from an empty cup. And a lot of us have metabolic issues too. And it's important to look at them and understand that, a lot of us have things like, if you have cerebral folate deficiency, you can have symptoms like chronic fatigue, attention problems, memory problems, depression. And, the question is how much of that, we always assume it's just because our lives are very difficult and we don't sleep very much and whatnot, but it could be underlying cerebral folate deficiency in addition. And so, a lot of times treating the parents, treating the kids, then the siblings can be really helpful for the entire family because, again, they may be positive. Just to share my story, I know that I have my triplets. They're now 13, but all three of them were positive for folate receptor antibodies. And I then turned around and tested myself, and I was positive. So I actually take Leucovorin just, to share my story. And I love it. I mean, I find that it really helps my attention. It helps my mood. It helps my insomnia. Actually, it helps my insomnia a lot. So it's very helpful. And so, yeah, definitely for parents too. Don't neglect yourselves. Very important. And then the last couple, I have two more studies here, is prevention. So I love treating autism. This is my life goal. This is my goal. But we want to prevent it. We don't want to necessarily be here. My goal is to have everybody go home and no more autism, and we can all go beer tasting down the street or something like, let's get out of here. But we're here. So, but what can we do to prevent it? Because it's really important, and there's a lot of take-home messages and new literature that's coming out with the studies. And again, more shameless plugs of my kids in Sequoia. The first study I have here, it's just a case study. It looks at one mom. This is 2015, so it's about 10 years old. And the theory is that, well, what if folate, these antibodies in a pregnant mom, what if it's blocking folate to her fetus? And what if that's preventing development of this fetus brain and causing miscarriages? So they followed one mom. She'd had fertility treatments. She'd undergone, I think, 3 treatments with IVF and unfortunate miscarriages. And then what they did is she tested for folate receptor antibodies and tested positive for both binding and blocking. So they put her on a milk-free diet, and they put her on 4 milligrams of active folate, and they put her on 5 milligrams of prednisone. And she got pregnant. The antibodies began to drop. She got pregnant a 4th time and unfortunately had that miscarriage. You can see right here. But the 5th pregnancy, once the antibodies for both binding and blocking got down to 0, she was able to conceive, and she had a normal conception, and then she delivered and had a normal delivery. So this may hopefully maybe shape some of the treatment for fertility treatments. Maybe this is an underlying cause. It's hard to speculate, but now the mainstay is taking folic acid, which may not be the active form for people and may be causing harm. So in this woman, we found that taking extra folate and obviously, like I said, reducing these antibodies was very helpful for her in particular. And then the last study, this just came out 2 months ago. So I think it was July or August. And it basically was a case study with 2 pregnant women or two women who were actually folate receptor antibody positive, and they'd previously had given birth to kids with autism. So both of them had autistic children. And they actually preconceptually, so before they conceived, they gave them 7.5 milligrams of folinic acid, and then they gave it to them daily throughout the pregnancy. And then they followed these children for 3 years. And what they found is that after 3 years, both of these children had no autism. They had no neurologic deficits, no problems. And so, this emphasizes the fact that we probably should be screening most, if not all, moms for folate receptor antibodies, certainly any mom that has a child with autism. So it's really likely, statistically speaking, that if you have a child with autism, that either you or your husband is positive for folate receptor antibodies, and treating this may be a game changer for future pregnancies. So, in our clinic, we do some preconception kind of counseling and just kind of look at labs and, hey, what's best practice for your next pregnancy? And this is definitely a big part of that, is looking for folate receptor antibodies. So that's the studies. I did want to just share my story just for, a couple minutes here. These are my babies. They're now 13 years old. They're actually in the room right now. Hi, babies. And I'm very proud, Mama. Their story, I share it, it's kind of a crazy story. So my husband and I, we got married. We tried to conceive. I had a miscarriage. We had some fertility treatments, and then I got pregnant with triplets. We developed normally. They developed normally until 2. At the age of 2, my boys regressed. My middle son regressed severely and lost a lot of functioning, all speech. And my daughter started having seizures. And so essentially, long story short, now, because that was 11 years ago, I basically found, Rossignol Medical Center. I went to MAPS, the Medical Academy of Pediatric Special Needs. I've, been working at the clinic for 9 years, just kind of dedicating a lot of my life to treating autism personally and professionally. And now my middle son, who regressed severely, he's actually lost his diagnosis. My eldest son, he's very, very close. He's doing really well, gen ed mainstream. So I'm very proud of my boys. My daughter's been seizure-free. And it's a crazy story, and I share it for, several reasons. The main thing is that, how does this relate to Leucovorin and the talk today? I mean, there were things that I know that we did along the way, because it's a long story. A lot of treatments that we did, diet, gut treatments, mitochondrial function, looking at metals, looking at environment, and, and a lot. But Leucovorin was definitely part of that picture. Again, my eldest son, when I started him on it, I did find, like I mentioned, that he calmed way down immediately, and he responded really well. And so, that was really helpful for us. When I put my other son on it, my middle son, ironically, he actually was one of those kids. He had some stims, he had some increased behaviors with it. And so what we did is we switched to compounded Leucovorin, and actually he tolerated it just fine, and we were able to titrate up to the dose. So, one of the take-home messages is that, titrating or doesn't always work sometimes. We may want to try compounded Leucovorin or even supplement form. I mean, there's different forms, talk to your doctor, depending, the tolerability may just be because Leucovorin is a commercial product, right? It's a pharmaceutical. I don't love that, but it's made with, compounds and some junk that sometimes kids don't tolerate. So, again, switching the form might be helpful. And then, for my son, my eldest son that initially responded well to it, we actually had him on it for several years, like 3 to 4 years. We were dairy-free, and they were doing really, relatively well. So I stopped it for a while thinking, well, the studies look at 1 to 2 years. We've treated the CFD. I was trying to kind of pull back. We were on a ton of things. And then, so we stopped it, and then later, fast forward a few years, to a couple of years ago, maybe when they were 11, we restarted Leucovorin, and I found that actually he had a super big response again. He actually was able to focus in school. We immediately went gen ed. All the reports from the teachers are like, this kid's great. And so, I don't know, and he actually went from like his current grade level to like 10th grade reading level in like 7th grade. So I thought we were doing well, and I guess we could have done even better. So my take home for that is that Leucovorin, I think, there could be a couple lessons, I suppose. It could be that, maybe we should have kept him on it, and I do have a lot of kids that stay on it for years, and that can be really effective. And also, the other take home may be that if your child you've stopped it for some reason, you maybe thought there was a bad side effect or whatnot, you just didn't think it was effective, it may be time to restart it again because, again, I think there are timings for development, and puberty may trigger the need for more leucovorin. And so just because they've failed it, maybe it's worth a try again. And then, the last part of my story is, again, looking back, had I done it again, I definitely would have tested myself for folate receptor antibodies and taken, active folate, because during my pregnancy, I had taken folic acid, thinking that was the thing to do. So, these are kind of lessons for me in, now, and I'm trying to share with you, is that, making sure you take active folate during pregnancy might be very helpful. And then if you're going to do formula for your kids, try to find, obviously breastfeeding is best, but try to find formula without folic acid. I know that's a little difficult, but it may be a developmental issue in the child as well. So, I really appreciate you listening to my story. I guess the main take home, the main take home is that, there's always hope. I love, sharing my story because because I've heard so many parents. There's so much you can do, and so many kids have gotten better. There's improvement. Maybe, there's different areas. I had a mom that told me yesterday, she said, that she was older, they started Leucovorin, and she said, I don't know if we can help, but this child's speech got a little better, but what she noticed was his movement got better, so that he initially, when they started Leucovorin, he could actually just start pointing to the letterboard, and she's using spelling to communicate. And she's like, that's been a game changer. And so even in the older ages, like, there's always things you can do. And so I'm here to tell you, don't give up hope. There's always room for improvement. And so, that's my story, but I'm not unique. I've seen other parents, so it can be really potent. I really appreciate you guys listening. I do have a big, not a big, but I have a Twitter following. I try to go do live chats and things, but if you want to talk to me, at Nicole Rincon PA is Twitter X, my handle. So you can DM me there because I love responding to people. And, we're going to try and do some Q&A right now, but this is Desiree, this is me. Let me know if you guys have any questions. Thanks for listening. You want to do one?
Yeah, they grouped it according to, the topic.
Okay. You want to go first?
I'll take a stab.
You go for it.
Okay. All right, we got lots of questions here, and Michelle was kind enough to kind of group them all together for us. I'm going to take a stab at it. This one says, can someone heal completely from CFD, and how often should you do a FRAT test? How do you test to see the amount of folate in the brain? No, I wouldn't say you can heal completely from CFD. I think if you have a propensity to make these autoantibodies, then you will continue to make them if you don't treat it. And the treatment is twofold. You have to go on a milk-free diet and then introduce some sort of folinic acid or administer some folinic acid to help folate get into the brain. How often should you do a FRAT test? Well, you should definitely get a baseline FRAT just to see where your levels are. I don't necessarily retest a FRAT unless I am concerned about going over the dosing. So I will retest. I would say at least a year. If you're going to retest it and you're not seeing anything and you're at your max dose, then I would retest a FRAT to see if there's any wiggle room or if we're even pushing the needle there with leucovorin. How do you test to see the amount of folate in the brain? Well, gold standard is the spinal tap, but I'm not sure many parents would want to do that. It's very painful. So you can. So the FRAT test is probably it's a really good test that almost everyone who walks through our door will get. Do you have to get the FRAT tests before they can prescribe leucovorin? Can you just get the folinic acid with the FRAT test. So it depends. When you come into clinic, we're going to talk about your kid, what are the current issues. We can prescribe Leucovorin empirically. I would also run a FRAT test, but we would prescribe the Leucovorin empirically if we feel like there would be some benefit. I would definitely not prescribe it to a child who already has irritability, hyperactivity. Those things need to get under control first so that the child can tolerate any unwanted side effects. Speaker said antibodies are a marker of who can benefit. Which antibodies, who will test for this, will insurance cover it? I think it was Nicole in your part where you're saying it was binding, right?
For which one?
Antibodies are a marker of who can benefit. So which antibodies? I think you spoke about how binding autoantibodies can.
Which antibodies which benefit from Leucovorin? Well, I mean, all of them. I mean, the trials are for binding and blocking, but specifically that one, the study with Dr. Fry was in 2024. Yeah, sorry. Sorry, yeah. Yeah, both binding and blocking antibodies can be treated by Leucovorin, but the study from Dr. Fry in 2024 was, I think it was binding specifically.
Yeah.
So, but again, thank you. Sorry, I didn't mean to.
No.
Okay. These are actually really good questions. So is Leucovorin still effective in kids with autism versus young kids? And I like this question. I like to address it a lot. And absolutely yes. That's why I include that trial that looked at kids of all ages. Again, you can see improvements in coordination, movement disorders, irritability, and even some autism. So all ages. I mean, and I don't know this, and I'm just speculating this, but it'd be interesting to see if there would be any benefit in Alzheimer's, Parkinson's. I mean, some of these neurodevelopmental disorders, maybe these adults actually have it too, grandparents. I'd love to see studies about that. So I do think that there's benefit at all ages. I highly encourage people to try it at all ages. Absolutely. Because again, even at me, as an adult starting it, I notice an improvement in my sleep and anxiety. And I just generally have more energy and feel better. So, I mean, I can imagine if I was a child with autism that would likely, feel good as well. So, let's see. Yeah, again, a lot of age stuff related here. Let's see. The question is, do they need to take it for life? So there's this interesting study I didn't include, and it actually showed fluctuating antibody levels. So what they found is that when they tested kids repeatedly, sometimes they'd be elevated and sometimes they'd be negative. And they did a serial test. And so they probably need to be on it for life, depending, only because these antibodies may fluctuate in and out. And unless you're going to test them all the time, if you catch them on a negative test, you might say, oh, we don't need it. And again, this is why I share my story, is I kind of had that mentality of, we're doing really well, it's been several years, maybe we should stop it. And, we got big gains when we restarted it. So I think it's hard to know the dosing, and again, these trials are so new, we haven't studied kids for decades. Again, the first study looking at Leucovorin for cerebral folate deficiency and autism, I believe, was in 2004. So, the long-term data is not there, but there's a lot. It's been 20 years. So essentially, I would recommend staying on some type of a dose, but talk to your doctor. I mean, these are tough questions, and it needs to be, individual. What else you got for me here? Let's see.
This one is a lot of side effects.
Yeah, side effects.
And how to mitigate.
Okay. You want to hear? Let me I got this stack here. What are signs we can look for to see if Leucovorin is helping? What are signs that language is going to improve? So again, that if you look at trials, the higher the antibodies may indicate higher benefit, but that's not always what I see. I actually have a lot of kids that are negative, and we try it empirically because we suspect they have mitochondrial dysfunction, and we see good improvements. So you don't always know who's going to benefit. In general, a little tip is that cerebral folate deficiency can be associated with lower head circumference. So if you have these kids that are kind of smaller, and particularly with a smaller head, they may have low folate in the brain from birth or from young childhood. And typical signs that you see that it's working is, you really do have to be an investigator. You have to track. You have to watch your child because sometimes it is subtle. Sometimes it's just, hey, there's more eye contact, more sounds. It doesn't always start with words. It's not always he went from nothing to full sentences. It's he's babbling now. He's imitating me. We get more echolalia. So these kind of pre-verbal sounds and pre-communication can be signs. And again, my son, it was just hyperactivity. He was much calmer. It just seemed like he was getting things more. He was more present in the room. He wasn't as spacey. And so it could be, it could be very helpful, but you're going to have to monitor your kid essentially. Are all dairy products listed folate inhibitors or just milk? So, for the studies look at milk, I think Desiree talked about milk. It's basically cow's milk, Campbell's milk. I mean, it's all milk that's going to be triggering. They actually have soluble folate receptors in the dairy from the cows. That's why you create these antibodies. So it's going to be found in all animal dairy. However, there are some, dairies that are more, in general, more allergenic. So I think Dr. Quadros, I listened to talk of his, he said that maybe goat's milk is less allergenic, but again, it still has that soluble folate receptor. It's going to trigger these antibodies. So you really do want to do dairy-free in general. And is there any studies showing that vitamin D is related to it? Well, that's kind of a roundabout, not direct studies. Vitamin D is associated with a lot of autoimmunity, so probably in an indirect way. Vitamin D is great and is one of the supplements that we always, the biomarkers we monitor for and treat. Absolutely. Do you want to do any more? Couple more?
Yeah.
Okay. Desiree is going to take the last couple here.
Did we talk about side effects? Okay.
No, did you want me to do it?
No, this is a big pile.
Okay.
What are side effects of leucovorin? Side effects would include can include more irritability, more stimming, more hyperactivity. But then again, it also comes with a lot of the good stuff that we want too. What supplements or tools may be helpful to onboard in advance to help with tolerance? So this is a really good question. Like Nicole had mentioned, before we start anything, any supplement or medication that is activating or more stimulating, we like to get the kid at a more calm baseline. So some supplements that we have implemented and recommended would be something as simple as magnesium, L-theanine. If we need to introduce some medications, propranolol is really good. And all of these supplements and medications are very well tolerated by the kids in our practice. What are common side effects when taken longer than 4 months? It would be the same. It would be the same, but I would go back to your doctor and ask them how can we ameliorate these side effects if they're becoming unmanageable. Some concerns with leucovorin is regression and increase in problem behaviors. What can be done to minimize this? So again, like the calming supplements and medications would be helpful. And as far as like regression, I would probably look into other things that could be causing the regression. I have not read any studies that have shown that leucovorin administration would cause a child to regress. My son has been on leucovorin for 4 months, and we saw an increase in stimming, which has not tapered down. Is this expected to eventually stop? Yes, kids do need to get acclimated to their target dose. Again, talk to your doctor about some things that you can implement at home in order to calm him or her down. If my child started at 4, is there no opportunity for ASD behaviors to completely go away? were there no kids older than 3 who made a complete turnaround? What I have to say to this is do not lose hope. There is always work to be done. The child is always changing, always developing, acclimating to his or her environment, and developing in that way. So they are going to change, just as neurotypical children would as well. Now, yes, there have been cases where ASD has been cured, where there are no kids older than 3 who made a complete turnaround. Are we done? Oh, were there no, that may be a question for Dr. Rossignol. He's been doing this a lot longer than I have. But again, there's always something to be done. There's always different avenues that you can take in order to help treat your child. Okay, thank you, guys.
I know,
Thank you both for answering all of those wonderful questions that we had. Just a reminder for everybody, today we do have a lunch and learn with Ion Cleanse and AMD, so check your schedules for that. You can also visit the Rossignol medical team out at their booth, which is just to the right as you go out, across from the registration table. And don't forget, tonight we have our physician panel as well, where I'm sure these questions about Leucovorin will come up. So have a wonderful conference, and we will see you at the next presentation. Thank you.